Hi guys, karibu to yet another episode of GegoBase. Dr. Brian Harper. Now, today I'll be discussing a very critical topic, which is basically post-op management of pain. Post-op means post-operative. Post-operative basically refers to after treatment, usually the period a few days after treatment. So the various treatments that would result to pain. For instance, the most common is a tooth extraction. After an extraction, basically what is left is a wound, that socket, the area where the procedure has been done, or any surgical process, which also extractions fall under. Now for such cases, normally we would manage pain by prescribing analgesics, what you commonly refer to as painkillers. Now they vary depending on the anticipated or the expected extent of pain. So there is a range of painkillers that we use. So there are various classes of painkillers we use. Commonly we use NSAIDs. Those ones are good for dealing with inflammation and pain. And they are the stronger versions, the opioids, akina tramadol, the ones that tukikupatia tunambia wewe operate no machines like vehicles, because of the side effects, of course. So there is the painkillers that we prescribe. Sometimes when we expect swellings, we can advise cold or warm compresses of the area where the procedure has been done. Of course, not exactly in the socket if it's an extraction, but around the cheek, around that area, the affected area. Other modalities, other treatments that could lead to pain, probably sensitivity after cleaning. That is very common, but that one is basically managed using some desensitizing toothpastes. There is a variety of them in the market. Usually we would recommend one. If it doesn't work, we change to another until you get the relief that you require. Other scenarios, for example, when I do a root canal today, of course you came in with a lot of pain. After the root canal, we expect little to no pain. So for no pain, well, it's good. But if there's that little pain and if it's so uncomfortable, usually sometimes we'd call you back in. Mostly it comes on chewing, okay? When you bite something tough, sometimes we like to reduce the biting surface so that we give some relief, so that the pressure from the food that you consume when you bite is a little less on the affected tooth. Also, analgesics could work if the pain is continuous. Another scenario that could cause pain, yes, feelings. Also feelings present in the same way. Sometimes a feeling is deep, it has gotten to what we call dentine. In such cases, you may feel some sensitivity or some pain on biting, maybe if it's bumpy, a bit higher than the rest of the teeth. So yeah, in that case, we again trim it so that the occlusion, the bite is perfect. Or in some cases, if it's just the sensitivity, we would just recommend the desensitizing toothpaste and then observe. After a couple of days, it normally wears off. Basically, with all these kinds of pain that come post-operatively, it is important to be patient, and it is important to communicate with the dentist. Because when, for instance, if I treat you today and you experience so much pain the day after or 2 days after, it's good that you alert me so that I can listen to what it is that you're feeling. Probably I will ask some questions to gauge this pain and see if it's something I would expect or not. So if it's something I would expect, of course I will just give you some reassurance, tell you just continue with the medication, and then probably see me after a week, and you'll find the pain subsiding and wearing off completely. In other cases, if I feel the pain is too much, is not what I expect, then I will maybe prescribe stronger analgesics, or I will call you back in for an examination and further management of the pain. Alright, I guess that's it for pain management. In case of any questions, hapo chini uliza maswali. Love your smile. We love you too. Bye bye.